And again, the presentations are, I mean, I said 5 minutes or less, they're probably gonna end up being like a couple minutes. You're just gonna get up and like talk us through your infographic. Alright.
Yeah, because our exam is the 12th.
Yes,
So then we have like almost a whole week.
exactly. Yeah, and our exam is scheduled for 8:30, I believe, but we're gonna start at 9. Just because. Everyone will remember since it's our normal start time. And B, I'm never sure if I can actually get here by 8:30 since I drop my daughter off in the morning, so. And Lauren, I saw your email, didn't get a chance to get back to you about eating chapter 15. I'll just give you credit when I go in and grade. I meant to.
I did it and I forgot which one I just finished, and so then I clicked 15 again. And I was doing it and I was doing the questions and I was like, I've definitely done it before. And I was like, oh my God, I already finished it, and then I realized like every time I go to that one, it's just like begin, it wouldn't. say, okay,
Oh, that
begin.
sucks.
So.
Yeah. Hmm. Morning, good morning.
Oh,
Yeah, I was gonna say, don't eat anything that's been on this floor, because God knows. Alrighty, we're gonna go ahead and get started. All right, so folks who got here early were asking some good questions about the schedule coming up. So actually, real quick, let me open the syllabus so we can all be on the same page here. Because it's coming down to it, y'all. We only have 4 more like classes left. And then we have our exam period. So let me. All righty, get that out of the way. So we are here. So we're at the 28th. And so today and Wednesday we'll continue with our health psych lecture. I'm adding stuff in as I go. So use the link to the Google Drive one rather than the posted ones. I haven't updated the COVID stuff. I plan on doing that today probably. And then Friday, if stuff bleeds over, but we'll have a Jeopardy to review. A week from today, exam 3 will be distributed in class. And it's the same thing as usual where everything, I'll be here if you have questions, that type of thing. Your infographic is technically due then, but you know, if you don't get it in until the day we present them, that's fine. There is a place on Blackboard to turn those in. Also, I should have put it on the syllabus, realized I didn't. It's up further, but not on the schedule. PECs should be done by the 12th at the latest too. You have to have everything in by the 12th, so 2 weeks from today, because after our exam period is done, I only have 48 hours to submit your grades. So I need to get that stuff rolling. Our presentations, again, that's our final exam. Your 3rd exam is just going to be the last 4 chapters. It's not a cumulative final. So during our exam time, y'all will be presenting on your infographic. So, doing a little presentations on those. I would guess they'll take about 2 minutes each, but you know, you have up to 5 if you need it. And we're starting at 9. We're scheduled for 8:30, but I'm doing 9 for 2 reasons. One is y'all are used to coming here at 9, right? And the second is I dropped my daughter off at school, and like some days I could be here by 8:30, but like today I didn't get here till 8:40. So, when you come for infographic presentation, you'll bring exam 3 to turn it in. And I'd really like y'all to be here in person for that. Obviously, to turn stuff in, you need to, that it'll just make things go a little more smoothly when we're presenting. So yeah, you have 2 weeks to get in your PECs, to get in your all your stuff on Connect. I was going to catch up on grading over the Thanksgiving break, but unfortunately my entire family got the flu. So I'm not contagious anymore. I'm also wearing an N95, so if I was, y'all would be safe. But yeah, unfortunately, it kind of sucked. We had to cancel Thanksgiving. It was a bummer. So I'm just getting back to full strength. And so hopefully over the next couple of days, I will catch up on all the Connect grading. So thank you for your patience. I also owe y'all a explain it to the media quiz for this chapter that we're going through now. So again, I'll try to get that done today sometime. Alrighty, so we can dive back into our slideshow here. Let me put on the actually legible captions. Here we go. So we have been talking about bariatric surgery and some of the health and psychological factors related to that. And so we're going to finish that off, and then we're going to talk a little more about what's actually covered in your chapter. So the mind-body connection, that type of thing. So research findings about bariatric surgery suggests that if you have a successful surgical outcome, so you lose weight and you feel like your quality of life has improved. I mean, this is one thing I should say. The group of people who come in for this type of surgery have completely different motivations than a lot of folks who are just sort of like casual dieters. So like I would say why do you want to have this surgery? And they'd say stuff like, I want to be able to play with my grandkids, right, and see them grow up. So, improved quality of life would be that, would be able to like run around with your grandkids, things like that. So people who have those successful outcomes are not engaging in what's called grazing behavior, where you kind of eat little bits throughout the day. Instead, they're having those meals and snacks. They have strong support networks, which is great, and higher self-motivation and self-efficacy. So they believe they can do it and they put their mind to it. Side note about the support network, and this can be really important, but also can be a challenge. So here you have someone, I mean, some people with bariatric surgery will lose 50 to 100 pounds afterwards, right? So your body is going to look completely different. And unfortunately, some people's families and friends are not supportive of that radical change. And so there are cases of spouses divorcing after this, or, you know, estrangement from friends, things along those lines. So again, not something that everybody runs into, but it actually, I think, is the reason why, not all the time, but I would say maybe 10% of the clients we saw for pre-surgical evaluations would be people who either are gonna like simultaneously go through the surgery. Like I remember there was one day where like I had one sister and my friend Nina was doing the assessment on the other sister at the same time. Or it'd be like, my husband had this surgery 6 months ago and now I want to have it, that type of thing. So patients that came in with disordered eating already, right? They have a full-blown eating disorder, or they're binging and purging or something along those lines. They will have a short-term improvement and then unfortunately revert to disordered eating habits, usually within 2 years. And maybe not surprisingly, this is related to weight regain. And binge eating pre-surgery in particular may be associated with vomiting post-surgery. And they think this is because they try to binge eat, but the little tiny stomach can't handle it, right? And so then you end up vomiting, not because you're trying to, but because your body rejects it. So what would we actually talk about in these pre-surgical psychological evaluations? The first thing we talk about is why they're interested in getting the surgery. And like I said, for most people, I think I maybe had 1 out of the 141 that I did that said she wanted to look better. Everybody else was improved quality of life, wanting to be around for their kids, wanting to be able to be more active, things along those lines, health issues. And so then we would ask about their understanding of the surgery and the risks and the life changes they had to engage in post-surgery. They should have already had this because they would have met with the surgeon and did an information session before us, but some people just didn't understand. So part of our job here was to educate. Weight and diet history, the vast majority of these folks, it's not like they hadn't been trying other things. They would list anywhere from 5 to 20 diets they tried in the past. You know, Weight Watchers, and then Chitty Craig, and then Weight Watchers, and then my favorite was the woman who said, oh, I tried that Special K diet. I don't know if y'all remember this, but it was like, eat Special K 2 meals a day. And she's like, you could eat Lucky Charms 2 meals a day because you're just eating fewer calories than another meal. And then some really crazy diets, and people would fully acknowledge this, like the cabbage soup diet, which is just what it sounds like the majority of your food is cabbage soup, or there's a grapefruit diet that's similar. None of these are healthy, not surprisingly. You ask about substance use history, partially because alcohol, things like that are going to hit differently when you're absorbing things differently. And also because sometimes we'll have what's called switching addictions, which is someone who has maybe been like a casual drinker or a casual like marijuana user. When they can't eat to cope, they'll switch to that. So for example, one of the members of Wilson Phillips, I think it was Carney Wilson, had the surgery and like had never had a problem with alcohol and like developed a pretty serious one. So we want to kind of suss that out. Past medical or surgical history, we want to see, have they had weird reactions to anesthesia before, things like that, right? Just so they can help prepare, and also we would try to get them to help them be advocates for themselves when they came to the surgery, right? So like if you're someone who gets nauseous and throws up from anesthesia, there are things they can do to help you with that, right? Psychiatric history, we need to know, are you on psychiatric medications? Because part of what can happen, again, especially with the Roux-en-Y with the malabsorption, is your medications are absorbed differently. And so then you and your psychiatrist probably need to adjust that. Social history, like, do they have a trauma? Do they have generally good support? And that goes into current living situation and support system. Who's going to help you as you recover from your surgery? So that we had 3 potential results of the evaluation. The first was no contraindications. So this was the most common by far. I would say probably at least 80% of our evals were this. So they are just ready to have the surgery. There's nothing that'll get in their way that we can see. They're good to go. Sometimes we would recommend, but not require therapy. We'd say they don't have to undergo therapy, but it'd be a good idea to help them prepare to make these life changes. And sometimes we would require it. If there was some psychological factor that would get in the way of post-surgical success, then we'd say they must participate in therapy prior to surgery. And again, this wasn't meant to be punitive. We were really trying to help them succeed. Like, why spend all this money and all this time and undergo this major life-changing surgery if you aren't going to be able to succeed with it? And so we would look for disordered eating habits. So obviously the typical ones that we talked about when we talked about eating disorders this semester, binge eating, purging, but then really things like emotional eating. So eating when you're sad, when you're nervous, when you're angry, scared, when you're bored, right? And then eating in response to stress in general. So we would ask them, we would say, how do you cope with stress? And we say, oh, I eat. And you say, what would you do if you couldn't eat? And a lot of people would like name off a whole bunch of other things, but some people would just like their eyes would get really wide. And they'd be like, I have no idea. Those would be people we'd have do some therapy, right? To help them come up with new coping mechanisms. So for the substance abuse, alcohol abuse is going to interfere with their ability to follow medical orders. It can also be empty calories and absorb quicker. Also anything carbonated. So if they're drinking like beer or even like soda, obviously that's not part of alcohol abuse, but it can actually stretch that pouch out from the effervescence. So we want people to be careful with that as well. Alcohol abuse is also related to eating disorders and eating problems in research. And I mentioned the transferring addiction. And then again, drug abuse. Not only is it going to interfere with your ability to follow medical orders, but if there are physical side effects of your use, it can interfere with not only the surgery itself, but your recovery. So depression, what we worry about is lack of motivation. And the depressive symptoms related to appetite. So like you can't eat nothing, right? After you've had the surgery, you actually do need to make sure you're nourishing your body, or you can get really difficult health issues like malabsorption, malnutrition, bipolar disorder. Again, checking with the surgeon and their psychiatrist about medication absorption. One of my friends saw someone post-surgery, I don't think she did her pre-surgical eval, who had to go into the inpatient mental health ward because this woman flipped manic because her meds hadn't been properly adjusted and she was walking around naked like a day or two after her surgery, like, look at my new body, which like obviously it hadn't changed that quickly. So you want to be really careful with stuff like that. Anxiety disorders, if they have something that's going to interfere, so a blood injection injury phobia that's going to keep them from going to the doctor, right? Things along those lines, social anxiety. You want to work on that. And then self-harm, suicidality, PTSD. These are just things we want to help someone with in general, but also can lead to self-sabotage that can lead to very quickly to, unfortunately, some very severe medical issues. This is probably the most common question I would get. Why do I have to go through therapy? And it was to make sure that you could have post-surgical success. Can you make the lifestyle changes you need to make? Can you understand the doctor's orders? Right, I remember there was a man who just had low IQ. And so I think we did like 1 or 2 therapy sessions with him just for psychoeducation, just to help him understand more, put stuff into his words he could understand. So again, our philosophy, why go through all this time, all this money, all these appointments and undergo a major surgery, only to undo everything because you couldn't make or stick with these changes. So we really were trying to work in their best interest. These are the arguments you would hear against therapy. And some of these are common against therapy in general. This was my favorite. I won't be hungry after the surgery, so my emotional eating won't be a problem. It doesn't magically change your brain so you never get hungry again, right? It doesn't magically take away your stress. So hunger and eating in response to emotions are 2 different things. Will you still have this stressor in your life post-surgery? Probably. I could make these lifestyle changes when the time is right. I just can't yet, or I haven't yet, because so in therapy, we would have them practice. We would have them eat the small meals and snacks throughout the day, practice the other lifestyle changes. It's really difficult to do them all at once. Again, while you're recovering from a major abdominal surgery. This was my favorite. You're just doing this in order to get money. I was paid a flat, very low salary as a trainee. So I had to very calmly explain to people, yeah, no, I'm literally trying to help you. And whether or not you come to therapy, it's not going to make a difference to my salary. There are unfortunately post-surgical issues that are not uncommon. So sometimes weight loss will kind of plateau, often due to something like emotional eating, or they'll even regain weight. Sometimes there'll be difficulty with coping with the lifestyle changes, or they're changing appearance. So if you're someone who's always seeing yourself in a larger body, it can be pretty shocking, right, as you start to lose the weight. Plus, I think I mentioned last Monday that because you lose the weight so fast, you'll end up with these skin rolls. And a lot of people will have some dysmorphia around that. The transferring addiction, and sometimes they'll just have something else come up that will interfere, right? And so we always made it clear to them we were available. We had a group that we ran for people both pre and post surgery, and just tried to offer them as much support as we could. Alrighty, so that is a wrap on the specific issues that I'm fairly knowledgeable about. And now we're gonna go a little more in depth over what your chapter covers and talk about the mind-body connection a little bit more. So health psychology itself is focused on establishing health and healthy lifestyle, and then preventing illness. And then you'll also hear this term behavioral medicine sometimes. And that focuses on behavioral and biomedical factors. So what behaviors are you engaging in that might be helping or hurting your biomedical issues? That being said, oftentimes health psych and behavioral med will end up being used interchangeably. So you might hear them both used in that way. Health promotion can be a big part of what psychologists in this area do. So helping individuals just improve their lifestyles, even if they aren't having an acute health issue. So focusing on things like wellness, mindfulness. And then public health. So sometimes psychologists are involved in larger public health initiatives. So for example, I think the CDC probably should have integrated more psychologists to help them figure out how to like tell people how to use the measures to mitigate against COVID, right? They can help with how do you present stuff? How do you try to get information out there in a way that's the most effective? And then how can you like target specific at-risk groups, for example? So health psychology, like most of psychology, but even to a greater extent, really comes from this biopsychosocial model, which is they're going to look at the biological issues, right? What physical issues are you having related to your health, right? This might be having contracted a virus. This might be genetic things, right? It might be an acquired injury if you had a fall or something along those lines. And then your psychological factors, do you have anxiety or depression that's getting in the way of you seeking treatment for carrying through with it? Has your condition caused some psychological issues, right? So let's say you have physical issues because you were in a car accident. You might also have psychological issues like PTSD as a result, right? And then social factors. Can you communicate effectively with your medical team? Do you have social support at home who will help you to recover, work through things? So the mind-body relationship is really the core of what health psychology is. So the impact of the mind on the body, the choices we make, the attitudes we have towards changes we would need to make for our health, right? That can really matter. If your doctor says, hey, you're starting to maybe get some high blood pressure, you should probably change your diet and exercise. And you're like, that's not that important, right? That's going to get in the way. We also look at the impact of the body on the mind, right? Are you having physical stress? Is that affecting you? Are you having issues just coping with your diagnosis, right? So I talked about this with HIV, that some people would just need help kind of coming to terms with the fact that they have this diagnosis now. Cancer is fairly similar, right? So I worked in a breast cancer clinic for one rotation. And my job was to go in after people had just been diagnosed and to check in with them and offer them resources, right? And just sort of let them know we're there, because at that point they're in shock most of the time. And then the impact of other things that are going on your mind and your body. So sometimes the illness itself can affect your brain. That's one of the things we'll talk about on Wednesday when we talk about COVID, right? Is that people are experiencing this fog or early dementia as a result of it. And sometimes just the stress of knowing you have an illness, right, can be exhausting and can impact things. Just a nice little illustrator of this connection. I saw a grand rounds when I was in grad school about this. So they took medical students and with their consent made just a little tiny cut on their tongue. And they did it at 2 different times in the semester. One was just normal point in the semester and one was finals. And what they found is during finals time, the cut healed more slowly. So if your body is already stressed, it's going to affect its ability to cope, to heal, to do normal things. There are different models of how we can help people make behavioral change. Making changes is really hard, right? People are pretty much creatures of habit. We like to do what we know works, right? And so if you're asked to make drastic changes, or you just have to because of your health, that can end up being really difficult. So there's the theory of reasoned action. And that says that effective change requires specific intentions about your behavior. So this is what I'm gonna do, and here's how I'm gonna do it. A positive attitude about the new behavior, not, oh, I have to do this, but trying to reframe it and like, what's good about this? And then perceptions of social group support. The theory of planned behavior says that effective change also requires you being able to see you do have some control over the outcome. Right? If you feel like nothing you do is going to matter, you're going to be a lot less motivated to make any changes. But if we can show you, hey, this is going to make a major change, it'll make a difference. So I'll use the example of my gestational diabetes. So when you have gestational diabetes, the biggest risk factor is that your baby will just be huge, which obviously could cause some issues during labor. But there are some other risk factors to both mom and baby as well, right? And so I recognize that, and I recognize like this is a problem I need to address. And there's actually like a world-renowned gynecologist at EBMS who has a specific program that she developed to help people with gestational diabetes. And so it's like a very regimented diet and exercise. And they were able to show me like, hey, this works, this makes a difference. And as I implemented it, I saw that it made a difference in my daily readings. And so I had a perception of a control over that outcome, right? But if I thought, oh, nothing I'm going to do matters, right, then it wouldn't have made a difference. And so one criticism of these behaviors of like reasoned action and planned behavior is not all of our decisions when we're in a health crisis are going to be rational, right? A lot of times there's a lot of emotions that roll around, again, particularly when you are given a diagnosis of something like cancer, right? And so to expect people to just like, let's think in a very rational manner might not be that realistic. And so that's part of what we do as psychologists, is recognize and support those folks. So how do we make lifestyle changes? So, you know, the example they're giving here on the slide is something like quitting smoking. We know that quitting smoking is really difficult because tobacco is actually more addictive than heroin. So if you've ever had a family member who like tried to quit and keeps going back, cut them some slack because it actually really is difficult chemically. So the first stage of change is just pre-contemplation. You're like not even ready to think about it. If someone brings it up, you just sort of brush them off. Contemplation is when you start to acknowledge the problem. I probably do need to change this. Then preparation and determination is where you would have a plan of action and explore your options. So again, let's think about something like smoking cessation. Do I want to try the patch? Do I want to try the gum? There are now medications you can take that help reduce cravings. Can I take those with the other medications I'm taking? Right, things along those lines. There's a support group. Would that be helpful to me? And then you've got your action and willpower where you commit to and you enact your plan. And then the part people often forget about is maintenance, right? Once you've made this change, that's great, but then you've got to maintain it. Again, with something like quitting smoking for the rest of your life, right? And like different situations are going to bring stuff up. One of my grad school professors talked about he hadn't smoked in 20 years, but if he walked into a bowling alley, he would like reach in his pocket subconsciously for cigarettes, just because like that's where he smoked a lot. So kind of recognizing those triggers and recognizing those environments that are going to bring stuff up. So avoiding relapse, focusing on long-term success, focusing on sustainable change, right? So what resources are available? Well, one of the things is personal motivation. So self-determination theory is, can I do this, right? Can it come from within me? Am I able to focus and believe in my ability to do this? We talked about in our motivation chapter, the intrinsic versus extrinsic motivation. Here is where you often really need intrinsic motivation from within yourself to sustain it. So this is something I actually want to do. I truly believe this will help me. But you might also need some extrinsic motivation. So sometimes people will do things like kind of reward themselves. I've gone a week without smoking. Let's go out for a nice dinner, something like that. And then implementation intentions. Again, is this going to be sustainable? Am I being completely unrealistic, right? If someone says, I'm just going to stop smoking cold turkey and not use a patch or anything, that might not be realistic, right? So thinking about ways that are sustainable and thinking about doing things we shouldn't do. So again, social relationships, you keep hearing me mention these. Having social support from your friends, from your family, even from your workplace, your doctor, right, can be so important. Sometimes there's actual tangible assistance, right? Your spouse is the one who cooks, and they change how they cook to fit what your new lifestyle changes need. Helping them with information. So sometimes this is about educating them. And sometimes in social relationships, people will educate themselves. I don't know if anyone's ever seen the movie 50-50, really cute movie with Seth Rogen and Joseph Gordon-Levitt. It's based on the director's true story of when he got cancer. And Seth Rogen's character is the supportive friend. And Joseph Gordon-Levitt goes like over to his house and he's in the bathroom and he finds these books about like supporting someone with cancer, right? And just like the fact that his friend has done this really touches him, right? And in the age of Google, right, this is even easier. And just offering emotional support, right? Recognizing that sometimes you don't need something fixed and you don't need information, you just need someone to sit with you while you think about how much this sucks, right? That can be the most important. Or things, I should say, like tangible assistance can be taking you to your doctor's appointments, things along those lines. If you're going for something like chemotherapy, you're not going to be able to drive yourself home, right? So you need that support. And then religious faith, that it doesn't matter which faith you are of, but just having a religious faith and not being forced into it, but something you truly believe is linked to a longer and healthier life. And primarily in nations that are themselves religious. So stress itself has implications on the body, starting with the brain. So as you move through, you all take more psychology courses, you will hear the HPA axis come up over and over. This is the hypothalamic pituitary adrenal axis. And this controls reactions to stressful events. And if you're someone who has chronic stress or has a lot of acute stressors in your history, if you're someone with a tendency towards an anxiety disorder, this will not operate in sort of a normal regulated way. And so stress is actually more difficult to process for people who have irregular HPA axes. It's like your body doesn't handle it as efficiently as other folks. And so here we come to psychoneuroimmunology. Wow, I can say the words, I swear. And this explores the connection among psychological factors that we've been talking about, the nervous system, and also our immune system. We know that stress can affect the immune system, as I mentioned, the study with the med students. And we know, as I just mentioned, that both acute stressors and chronic stressors can decrease our ability to cope with stress, which in turn will decrease the effective functioning of our immune system. So when people are really stressed out all the time, they're actually more susceptible to infectious diseases. We also know that stress is linked to things like cardiovascular disease, particularly chronic emotional stress, and then major life changes, being fired, things along those lines are going to increase risk. So if you're someone that's stressed all the time, your job is really stressful, it can actually affect your heart health. And then cancer, what happens there is that you are basically in cancer, your body sort of works against itself, and like the immune system doesn't function the way it should because it thinks the cancer is your own body. And if you're stressed out, that's going to inhibit your ability, like your immune system, even more. So stress with cancer can be really problematic too. So how do we cope with stress? Cognitive appraisal is one of it. So how are we perceiving the stress? Again, thinking about, is it insurmountable or is it something that I can handle? Emotion focused versus problem focused coping, right? The ideal is to get to problem focused, but again, that's not always realistic, right? And especially when you get a diagnosis, you might be sort of mired in this emotion for a while. Optimism is actually shown to be related to health. So if you believe you might get better, it actually is related to like stronger immune responses. And my guess is this would link to the stress aspect, and that's why, right? So if you think there's hope, you might be a little bit less stressed. That's going to suppress your immune system a little bit less and help out. Hardiness is another idea. This the concept came up with by a psychologist whose last name was Maddie. And this is a sense of commitment and control. People who are very hardy perceive problems as challenges and not threats. And so they're able to sustain. And so self-help groups, stress management programs can be really helpful here. Okay, but how do you actually cope? Like, I feel like this is an area where your book could use a little more help, right? And so there are basic psychological techniques you can use to help with stress and to help when you're feeling overwhelmed. So a really simple one is diaphragmatic breathing. That's just breathing from your muscle right here. This is called the diaphragm. It controls the intake of your air through your lungs. If you ever want to really feel it work, all you have to do is lay down and relax for a little bit, and your diaphragm automatically kicks in. So you can consciously do some breathing. Related to that is progressive muscle relaxation, which involves really focusing on helping your body to relax. And I have a video related to that we'll go ahead and look at. Yeah, there we go.
Progressive muscle relaxation. Stress, whether you realize it or not, creates tension in the body. Patients with rheumatic diseases tend to have a lot of muscle tension, especially when trying to cope with the daily joint stiffness and pain. This next exercise, known as progressive muscle relaxation, involves purposely tensing and relaxing different muscles so you can more easily identify the difference between feeling tense and feeling relaxed. Just like the first exercise, the end goal here is to feel less stressed. Also, it's important to note that you should not engage in any of these exercises if you have pain in different parts of the body or distress or limitations. You should not be in any discomfort while doing these exercises, so please feel free to modify or eliminate any of the strategies as you see fit. Let's practice. Again, find a comfortable place to either sit or lie down. You can begin by taking
And again, folks who are here in person, folks that are at home on Zoom, please actually feel free to follow along as she does this activity.
a few deep, relaxing breaths. Let's begin by bringing attention to your feet. Curl your toes in tightly to feel the tensing muscles of the foot, of both feet. Hold this for a few moments before releasing the tension and relaxing the feet. Do you notice the difference? Noticing the difference between a tense and relaxed muscle is the purpose of this exercise. Now we're going to repeat this relaxation exercise with different parts of the body. Now, point your feet down, pointing the toes down toward the floor, feeling the tension in your calf muscles. Hold that for a few moments and release. Once again, noticing that change from moments of tension and moments of relaxation. Now, bringing attention to the thigh muscles, point the toes upward toward the ceiling, feeling the tension in the large muscles of the thighs. Hold that for a few moments, and when you're ready, begin to release. Now bring attention to the buttocks, tightening the muscles of the buttocks as you sit or lie on the floor. Once again, holding this for a few moments and gently relaxing. Bringing attention to the belly, to the muscles of the abdomen, and tensing these muscles as if you're bringing your belly button in, pushing your belly button in toward the spine, and holding here for a moment and gently relaxing. Noticing the back, and here just gently arching the lower back and seeing if you can feel the tension along the muscles in the back as you arch the back. Hold for a moment or two and then slowly release. Working our way up to the shoulders, a place where we tend to hold a lot of tension. Bringing your shoulders up towards your ears, squeezing them up, holding them for a moment, and slowly and gently releasing the shoulders. Now focusing on the hands, making the hands into a fist and squeezing tightly. Hold it another moment and slowly release. Now working up to the arms, you can just gently keep the fists if you like and bring the lower arms toward the upper arms. Pulling the forearms up towards the upper arms, tightening the biceps, and slowly releasing. And finally, bringing attention to the face and the mouth. Here, we're going to squeeze our eyes tight, holding them shut tight, pursing the lips. Holding for a moment and slowly relaxing. Once you've tensed and relaxed all of these muscles, notice how your body feels. Allow yourself to feel totally relaxed as you sit or lie here. You can do this exercise daily.
So that just gives you one example of a easy, quick coping mechanism. And then a big thing, not only in psychology, but I think in sort of the world at large now, is mindfulness meditation, which can also take on the physical component of yoga. We'll come back to this if we have time. But another set of coping skills that can be really helpful is what are called distress tolerance skills, which is fully acknowledge that there are times in our lives, right, where things are overwhelming, where things suck, right, where we are going to have stress, and what can we do in those moments? So if you're having like a very extreme reaction to something, this tip activity can be helpful. So temperature, if you're feeling really mad, really overwhelmed, you're probably overheated. So holding an ice cube, splashing your face with cold water, if you have one of those like freezer rollers from your face, right, using that. Intense exercise, just to sort of get some of the stress out. Paced breathing. And then the muscle relaxation we just looked at. Accepts are another set here of things you can do when you're just feeling really distressed, really stressed out. So activities, engaging in an activity that you enjoy, reading a book, going for a walk, calling your friend, contributing, finding something small you can do for someone else, right? Even if that's just like listening to a friend while they're having a bad day, taking them to Starbucks, right? Something along those lines. Comparisons, thinking about, you know, and this can be helpful or not, depending on your situation, but sort of putting things in perspective. What are people who are less well off than you experiencing? Emotions. So this is opposite emotion. So if you're feeling really depressed or upset, Google image search adorable puppies or ugly puppies to make yourself laugh. Push away. It's okay to just sort of like table something, right? Put it out of your mind if it's just not the time to do it. And then thoughts, thinking about activities that'll help you break the cycle of those thoughts racing. So something like a Sudoku or solitaire, or if you have a little game on your phone that you like. And then sensation, some sort of self-soothing behaviors, like if there's a aromatherapy you really enjoy, or a favorite snack, things along those lines. And then the last set here are improve. So things you can do to improve your mood, or just reduce your stress level. So imagery. You can imagine yourself dealing successfully with the problem, or you can imagine you're somewhere you're not. Imagine you're on the beach somewhere. Imagine you're in the mountains, sort of wherever your happy place is. Trying to find meaning, lemons on a lemonade in a situation. Prayer, if that works for you. For some people, prayer is just meditation. For some people, prayer is talking with a higher power. Relaxation, so it can include formal relaxation like we just went over, but it can include something as simple as like taking a bath, taking a walk. One thing in the moment, so trying to do something like make yourself a cup of coffee in your Keurig and only focus on that. I don't know about y'all, but like when I'm doing something like that, usually I'm like on my phone and also checking something else, right? So just focusing on that process. Take a mental vacation. You know, if you just need to crawl in bed and put the covers over your head for 5 minutes, you know, do what you need to do to just distance yourself for a minute. And then encouragement, giving yourself encouragement. And this is something that even Olympic level athletes do. So if anyone remembers Laurie Hernandez from the 2016 Rio Olympics, well, anytime she went to do something, she would take a deep breath and say, I got this. And then she'd go and, you know, win a silver medal on beam. So definitely things that can be really helpful. And so, yeah, I have an example mindfulness meditation here. And then I also have a big list of coping skills that might be helpful. I figured these would be pretty relevant as we go into exam weeks. So I threw those on here. All right, so the starter class on Wednesday, we have a mind body activity we'll do. And then we'll talk about COVID as well. So have a good couple days and I will see you then.